Since becoming a division of the Department of Community Health in 1999, the Georgia State Office of Rural Health works to improve access to health care in Georgia's rural and underserved areas and reduce health disparities in Georgia's diverse populations. Of Georgia's 159 counties, 120 are defined as rural, having a population of less than 50,000 residents. In addition to supporting all of our rural communities, the Georgia SOAR offers its services to 69 small rural and critical access hospitals, 82 rural health clinics, 6 migratory and seasonal agricultural worker health clinics, and 34 federally qualified health centers with a total of 276 clinic sites. Located in Cordele, Georgia, the SOAR office is comprised of 4 program sections: Hospital Services, Primary Care Office, the Georgia Farm Worker Health Program and Health Care for the Homeless, and the State Office of Rural Health Programs. In fiscal year 2020, SOAR administered 55 core grants and contracts developed to improve access to primary health care through education and training, technology, and collaboration among the multi-levels of healthcare providers. Due to the impact of the coronavirus pandemic, SOAR developed an additional 184 state and federal grants to provide support to rural providers, clinics, and hospitals across the state. A total of 239 grants and contracts were executed and managed by SOAR during fiscal year 2020, totaling $33.4 million. Annually, SOAR manages multiple federal grant programs including the Small Rural Hospital Improvement Program, Medicare Rural Hospital Flexibility Grant, the Health Center Cluster Grant, the State Office of Rural Health Grant, and the Primary Care Office Cooperative Agreement. Additional programs managed through the Georgia SOAR include the Healthcare Professional Shortage Designation, J-1 Visa Waiver Program, the National Health Service Corps Loan Repayment Program, and management of the National Rural Recruitment and Retention Network. In addition to these federal grant programs, SOAR manages multiple state-funded grant programs including the Georgia Charitable Care Network Grant, the Georgia Center for Oncology Research and Education Grant, the Augusta University Statewide Area Health Education Centers Grant, and Georgia Association for Primary Health Care Federally Qualified Health Centers Grant. Since 2015, the state of Georgia has also provided $15 million in grant funding to assist 30 financially fragile rural hospitals through the Rural Hospital Stabilization Grant Program managed by SOAR. The National Organization of the State Offices of Rural Health is the membership association of the nation's 50 state offices of rural health. Launched in 2011, National Rural Health Day was an idea that developed out of a vision to formally recognize those whose work and contributions make a positive impact on the vast and varied healthcare needs of people living, working, and raising their families in rural America. We set aside the third Thursday of November every year to celebrate National Rural Health Day and recognize the power of rural by honoring the selfless, community-minded, can-do spirit that prevails in rural America. This special day each year gives us the chance to spotlight the unique healthcare challenges rural citizens face and showcase the extraordinary efforts of rural healthcare providers, state offices of rural health, and other rural stakeholders who support our mission. Please join us in celebrating National Rural Health Day 2020.
The power of rural.
The power of rural.
The power of rural.
On behalf of all the staff at the Georgia State Office of Rural Health, we want to virtually wish you a happy and wonderful National Rural Health Day.